What if the answer to some of the world's most devastating and widespread neurodegenerative diseases had been right before our eyes for over 100 years? These ghostly, flickering images are pictures of the insides of our bodies. A beating heart, the delicate lacework of veins inside our head and neck, blood flowing through a vein, a journey through our brain. Recent advances in imaging technology, such as MRI and Doppler ultrasound, allow us to look inside ourselves in far greater detail than has ever been possible before. The challenge is interpreting and understanding these images. In 2008, researchers hypothesized that multiple sclerosis, a neurological disease that has puzzled us for some 150 years, may be helped by a simple vascular procedure. Since then, there has been a storm of publicity, some supporting the claim, some contradicting it. For patients struggling with a debilitating degenerative disease, the challenge is also making sense of the torrent of conflicting reports.
My name is Sandra Burrell, and I have MS, and I've been treated for chronic cerebrospinal venous insufficiency. I decided after my treatment to found a society to help further research and education in Canada, and did so in 2010 with a couple other MS patients. And we just celebrated our 1-year anniversary of the society, and shortly after that, we were thrilled to be granted full charitable status here in Canada on December 2nd, 2011. One of the things that we feel is very important to our mission is to bring together researchers and patients, because I think that dialogue is important for patients to hear firsthand what's happening in the research community. And to that end, we had a conference on September 10th, 2011 in Victoria, where we brought together the leading experts from across North America to talk about their current research and to open that dialogue with patients. And in an even broader way, on November 20th and 21st, we ran a continuous 36-hour global CCSVI Expo that brought together 60 different speakers from around the world, including about 22 experts, and viewed by over 3,600 people from around the world in about 40 different countries.
The Society has brought together doctors and researchers from different fields who have a shared interest in the new ideas that the discovery of CCSVI has opened up. They're also beginning to develop theories that might explain the link between CCSVI and MS. Multiple sclerosis, or MS, was first recognized in 1868 by neurologist Jean-Martin Charcot. Nearly 150 years later, we still don't know what causes it or how to cure it. What we do know is that it occurs more frequently further away from the equator, which means that Canada has one of the highest rates of MS in the world. Each year in Canada, around 1,000 new cases of multiple sclerosis are diagnosed. That's about 3 new cases every day.
Woke up one morning and I couldn't pee.
Well, I woke up one morning with my right arm being totally numb.
Went numb from my left breast down to my feet. Nothing too bad, and honestly, I had been experiencing symptoms like that since I was a teenager, and I just thought, you know, it's just the way it is, no big deal.
I found out when I was working And I would walk to work, and my knee, it just felt like I would have to, it was not working properly. I had to pick my leg up and put it in front of me instead of just normally walking.
Went up to the lake in the summer with the kids that I still had, and that was when it struck me, because I was walking from the lake to the cabin, which is probably about 2 city blocks, but in sand. And I was having a terrible time. I kept falling down, and I started to cry. I got up to the cabin. I cried because they had said I had MS, right? And I hadn't even known what that was. And so I had asked, and they told me it was a debilitating disease. It would get worse over time. And I thought, here we go.
I was the business manager at our business. Loved working, loved the people I worked with, and I continued to try to work, but unfortunately I was hit with another attack which left my left leg totally numb. And it was after that that the doctors they did another MRI to see what was happening. Originally there was only 6 lesions in the brain, and then after the last attack there were 18. So they kind of said, you're done. You're not a good idea to be working. So you lose your career, your independence. And
I started to get very rough shape in the summer of '96. Initially my right foot came off the bicycle pedal, because as a good workaholic you'll fit your exercise in on the way to and from work. And then I started to get weakness in my right side. And by the end of that summer, I couldn't empty a syringe with my right hand.
Bill Code was a practicing anesthesiologist and brain researcher, so he understood better than most what it meant when, at the age of 42, he was diagnosed with MS.
In anesthesia, you see MS patients from time to time, often in the hospital. It's usually the sickest ones. They have their own special set of problems depending on how severe their MS is and their bladder issues and other problems. So the ones I saw were very sick ones. So that was a tough backdrop to get told I had MS. To me, it was almost a death sentence.
MS symptoms vary from person to person, but often include blurred vision or blindness in one eye, tiredness, shaking, lack of coordination, and difficulty thinking clearly. Later symptoms can include muscle weakness and balance problems, sometimes leaving the patient in a wheelchair, bladder and bowel problems, and difficulty eating and swallowing. Often, the disease progresses as a series of attacks where symptoms get much worse, separated by long periods, sometimes years, where not much changes. But each attack usually leaves the patients worse than before, and most patients get gradually worse over time.
Fatigue is huge. It's so hard to understand unless you love it. A lot of times I can wake up in the morning, go in and have a shower. I come out of the shower and I'm exhausted. I am completely tired. I have to go lay down again.
I had such a brain fog. It was almost cognitively, I couldn't get my words out. I couldn't think of words. Getting the right word for a situation, I'd be like, oh God, what am I trying to say? Or that was a nightmare.
Numbness, although you might say, oh, it's benign, it can't really affect you, it does. It leads to falls. It also, there was a time when I couldn't use any cutlery. I couldn't use any pens. I couldn't hold anything. I would put something in my right hand and it would immediately just fall out.
It's pretty bad. Like, I don't go anywhere without my walker or without a person to hang on to, because I put my hand on.
you can't predict in a week from now, like you would be able to book your holiday trip to go, wherever. We don't do that because from one week to the next, one day to the next. We don't know if I'm able to do it.
Well, I denied them for years. I could look back to 15 years of bladder troubles. I mean, since my mid-20s, I've been sitting down to empty my bladder. You know, just because I couldn't stand up, and I certainly couldn't go in a public washroom. I mean, I can again now, it's like a gift. But couldn't see having prostate troubles in my 20s. It just didn't fit, but I ignored that. And I had recurring headaches in my mid-20s. 70% of folks with MS will have headaches. I had some degree of sleep disturbance. I had intermittent fatigue, sometimes profound. One time I took a whole month off. That was called depression. Multiple sclerosis means multiple scars, because that's what sclerosis means, is scar. So if we get an injury here, we could call it sclerosis. So multiple scars, in this case, in the brain.
Using MRI, we can actually see the scars or lesions inside the brains of patients. This is now one of the tests used to confirm an MS diagnosis. These scars were described by Charcot when he first recognized the disease. He also noticed something else about the lesions.
We've known for 150 years these were always surrounding a vein. At that time, he didn't know whether the MS caused the vein problem or the vein problem caused the MS.
When, in the 1960s and 70s, MRIs first became available, the focus shifted to the brains of people with MS and away from the decades-old vascular theories. Researchers discovered that, inside the brain, cells, called neurons, communicate by sending electrical signals down long fibers called axons. These are like electrical cables with a central conducting core and an outside insulating layer called myelin. In MS, white blood cells from the body's own immune system appeared to attack and destroy the insulating myelin layer, leaving the axons unable to conduct electrical signals. Since that discovery, MS research has been focused on the immune system.
The traditional approach more recently in MS neurology, of course, has been to try and find something to dampen or control the immune system so this autoimmune disease slows down or stops. It hasn't been near as hopeful as we thought it was 10, 15 years ago. In fact, the 10-year studies are in now showing that it really doesn't improve our long-term EDSS, which is your everyday, living score. It doesn't change them at all.
Every time I had an attack, they were about 6 months apart. So I would just get over an attack, say I couldn't do up buttons, or I couldn't walk, or I got a slur speech, or double vision. And then 6 months later, another attack would happen. So every time I have these attacks, I would get this steroids, the prednisone, which was an IV, which went in for about 3 hours a time for 3 days in a row. Now, prednisone eats away at the hips, eats away at the joints. So I've had so much of that to try to heal me that at my age, at 48, I had to have a hip replacement.
Through immune system research, we now have a fairly good understanding of what is happening in the brains of MS patients. We still don't know why it happens, and therefore we still don't know how to prevent or cure the disease. In 2008, an Italian vascular surgeon, Paolo Zamboni, published a paper which suggested a link between MS and blockages in veins draining the head and neck, a condition he called chronic cerebrospinal venous insufficiency, CCSVI. He also devised a simple procedure to improve this flow, performed by vascular doctors.
We perform venous angioplasty, and we perform venous angioplasty on the major draining veins from the central nervous system, or the brain and the spinal cord. There's really 3 main veins, the 2 jugular veins and the azygos vein in your chest. They have narrowings in them that prevent the blood from going from your central nervous system back to your heart. It's a block in the pipes. We go in there and we use our balloons to open up those blocks so that the blood can flow back to the heart in a more normal fashion.
The blocked vein is located using a scan. A tiny balloon on a catheter is guided into the area, and the balloon inflated to open the vein. The balloon and catheter are then removed. The procedure has been used on arteries for many years, but its use in veins is much newer. Dr. Zamboni reported considerable improvements in some MS patients, leading to worldwide interest as this seemed to offer hope to many MS patients who had previously had none. A few other doctors in private clinics around the world began to offer the procedure to those who could afford it, with some promising results.
There are certain symptoms that we classify as CCSVI symptoms that tend to show sometimes and quite often very dramatic improvements. Improvements in their bowel and bladder function, improvements in their ability to sleep, the ability to think clearly, the ability to feel comfortable in warm conditions. There's many symptoms like this that fall into a category that we call CCSVI that tend to respond quite well to the procedure.
The procedure was performed a few times in Canada before doctors were told to stop using it on MS patients until its safety and effectiveness were proven. Approval in Canada has been slowed because CCSVI is being researched alongside MS rather than as a separate condition.
The fear-mongering that's happened so far has been just that. It's been fear-mongering by a small subset of people who haven't wanted to look at the facts and the details. This is a relatively safe procedure. In fact, it's a very safe procedure compared to coronary angioplasty. 1 in 100 of those will go on to coronary artery bypass grafting, opening the chest. Not this. This is at least as safe as having your gallbladder out. It'll probably eventually be even safer than that. Probably as safe almost as a general anesthetic. We'll make the change in Canada. It's already happened now. Saskatchewan has initiated a study which they will do with a US team, and they will start it. So they're not going to wait till the neurologists are all happy.
In the meantime, a steady stream of MS patients who can afford it are traveling to other countries to get the operation performed privately, including Noreen.
I'm optimistic. I'm hoping for some of the symptoms to at least be better. The possibility of it being some of them gone would be nice, but I think that would be overly optimistic. An improvement would be nice. I think the majority of people that I've talked to that have had it done, what they've noticed is a huge increase in no fatigue anymore. Even if that was the result of what I get, I'd be happy.
Many of those who have had the procedure are convinced that it works.
I feel, I've been stressed out and the fatigue comes back, but not anywhere near the degree it was, not even close. And the headaches, I haven't had any. And I used to suffer from headaches 2 or 3 a week at least, and they were debilitating. You don't want to get out of bed, and suddenly, we were terrified the whole 9 months I was pregnant with her because we thought, how am I going to do this with a newborn? I'm going to be up all night, blah, 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 all the usual. And it's just been wonderful. It's been such a gift.
Well, on traveling down to California to have my procedure done, I must admit, I felt surreal. I felt it was almost like an out-of-body experience. How could I possibly think something as small as fixing a venous blood flow could make a difference in my illness? But I went in not expecting the world to change or shift. Dr. Hewitt had outlined 3 things that he thought people would often gain benefit from. One was fatigue. Well, I had that. One was headaches. Well, I had that big time. And the other was, issues of autonomic function, which would mean bowel and bladder control. So I had problems with that. And I said, well, if I get any of those, I'll be happy. I got them all. I mean, everything on the list of CCSVI symptoms improved for me. So almost, the biggest one though, it was like a 15-year mental fog cloud lifted because my brain worked better. And to get that back was dramatic. Because I rarely shared this, my biggest worry with my MS was becoming demented. Because it happens to us 10 to 15% of the time. Pretty frequent. And I've had friends become demented. And I've had friends commit suicide because they knew they were starting down that road. And they'd made a pact with a friend that they would do it because they weren't going to walk there. Now I think my risk of dementia is much, much reduced. So that alone would be worth it.
Others can't afford it.
Can't afford that, no way. No, it's just, you know, I'm raising my girls and there's no way I have that money. I watch other people go and out of the country. That's one thing I don't understand. They're taking all this money out of the country. And they're coming back and they're saying, well, I have no fatigue, no exhaustion, and my brain feels clear. And it's like, oh, wow, that would be just such an incredible improvement. I do feel very jealous that, you know, why can't I come back feeling good like this? Why can't I get this? Just because I can't have, you know, $10,000, $15,000, $20,000 to spend on this. I do feel really left out and wanting to be able to get this done because, I mean, if it could make a little improvement on my life, you know, I'm not asking for a cure for MS or anything, but to improve my symptoms would be a really powerful thing in my life. I would be able to do that.
Good morning, how are you? Doing okay? Are you nervous? Why? We're going to take good care of you. All right.
It's sensible to act cautiously when introducing a new surgical procedure. But for those with progressive MS, waiting might mean losing the ability to walk, or see, or even think. Understandably, those who can afford it are keen to get the procedure done as soon as possible.
So the movement is huge because there's so many people with MS that are not willing to sit back and wait. I think the unfortunate part is that it's not available in Canada. It should be. It's not like we don't have good doctors here or good vascular surgeons, because we do. It's not like we don't have the radiology and the equipment to do the testing, because we do. It's just mind-boggling that it's not available in Canada, and it should be. And eventually it will be, but it's taking too long, because people with MS, it's like a ticking time bomb. You don't know when your next attack is going to be. You don't know what next bodily function is going to be taken away from you, and whether or not you're ever going to get it back.
At the moment, patients who can afford to are traveling out of the country, sometimes without telling their own doctor what they are doing, which means they may not be getting proper screening or follow-up care. Also, not properly tracking the outcomes of these surgeries is a huge wasted opportunity.
I have tracked 1,000 Canadians living with MS. They are in personal contact with me. Over 370 have now been treated. Our government should have been tracking them, but they tell me their progress, and no drug reverses the condition. And I am always very careful never to hope monger, ever. What the data suggests is about 1/3 seem to significantly improve, 1/3 maybe improve, and maybe 1/3 don't.
So I don't look at the treatment of CCSVI with venous angioplasty as being a cure for MS. I look at it as a brilliant symptom relief component for many of the symptoms that trouble folks with MS. I also, I've got a couple of different lists in my head. One is the CCSVI list, one is the MS list. If the folks with MS don't have any of the CCSVI list, they may not improve. And I've met a couple now who've actually already had treatment, but they didn't notice any difference. But they didn't have anything on the CCSVI symptom list. The fatigue, the headaches, the sleep disturbance, the autonomic problems of bowel, bladder, or even cold all the time, the muscle spasticity. There's a subset that are different. We've talked for years with MS. It may be 3 or 4 or more diagnoses in the same box.
CCSVI is not MS. It's a newly recognized separate condition, though a list of the symptoms so far identified as being associated with CCSVI reads almost exactly like a list of MS symptoms. Not all MS patients have CCSVI, and some people have CCSVI without having MS. But there may be a link between the two. According to the latest theories, cells from the body's immune system, which were thought to be attacking and destroying myelin, are actually removing already dead myelin from the axons that connect brain cells together, cleaning up after the damage has occurred. Something else is damaging the myelin layer, which suggests that MS may not entirely be an autoimmune disease after all. Also, those white cells which circulate in the blood shouldn't be in the brain. The brain sits in its own fluid, which is separated from the blood by the blood-brain barrier, tightly packed cells around all the capillaries, veins, and arteries, which prevent bacteria and other large cells from entering the brain. In the brain, as everywhere else in the body, blood flows in through arteries, through capillary beds, where oxygen and other nutrients are exchanged, and out through veins. In the arteries, blood is at high pressure, pushed by the heart. It is this pressure that is measured by a doctor when taking blood pressure. Before entering the delicate capillaries, the pressure is reduced. Blood then needs to flow at a steady speed through the capillaries and out through the veins, all at low pressure. Studying how this low-pressure blood flows in the veins is not easy. It's only very recently, using advanced Doppler and magnetic resonance imaging technology, that we've been able to look at the flow of blood through veins.
Veins, nobody's ever cared about. Pictures of veins have never showed up until CCSVI appeared. Otherwise, they never even looked at them, never even considered them. For us to actually find information on the veins, the venous circulation, what happened where, we had to go back 70, 80 years, and then the studies that were done at that time, which became dogma, were done with tools of that time. The tools of that time were inadequate to really understand what's going on, so therefore assumptions were made. They get into the medical textbooks, they are now dogma.
In MS, blood is entering the brain. For this to happen, there has to be a breakdown in the blood-brain barrier. In these scans from actual patients, we can see the complex network of veins that drain blood from the head. A blockage in one of these veins won't cause a sudden dramatic problem. The low-pressure blood will usually find another way back to the heart through small capillaries or through a detour in other veins. But a blockage in a vein leading from the brain could cause the blood flow through some of the brain capillaries to slow down. This in turn could cause an increase in pressure in the brain capillaries as the blood pools and backs up, weakening the blood-brain barrier and allowing blood cells into the brain, which then in some way damages the myelin.
I looked at the literature and developed a hypothesis that MS could be due to low blood flow in brain, which causes damage of the myelin, causes change in blood-brain barrier, resulting in immune cell activation and immune attack on myelin.
This theory is further supported by the discovery of abnormal iron deposits in the brains of MS patients, possibly from leakage across the blood-brain barrier.
About 2/3 of MS patients that we evaluated had abnormal levels of iron in one or many of these areas. So this became really a biomarker of people who have MS. What we think might be happening is that this obstructed flow might be leading to increased pressure on the vessel wall, or the reversed flow that Zamboni refers to as reflux might be leading to this problem that causes a breakdown of the endothelium, and so we then measure the end product.
CCSVI may also have links to other brain disorders.
ALS or Lou Gehrig's disease, perhaps Alzheimer's, perhaps even autism. I think even some psychiatric disorder, such as bipolar, anxiety, depression. Things that we have nothing to offer yet. Why wouldn't we look for a vascular solution?
CCSVI has opened up new fields of research and new ideas about multiple sclerosis by reintroducing the idea that it may in part be caused by problems in the circulatory system. Unfortunately, much of the discussion around it has been clouded by sensationalist publicity and a strong backlash from the medical establishment, not always scientifically based.
This debate became very polarized in Canada when Zamboni's work was covered in November 2009. Between then and when the next study was published, we had opinion, we had intuition. That's not scientific evidence. And we had comments like, I think millions of dollars are going to be spent following a hoax. If I thought there was substance to this, I'd be all over it. That's opinion. That's not scientific evidence. We need evidence. CCSVI must absolutely be subject to the rigors of the scientific method, but it can't be a new scientific method where opinion over evidence. It can't be single studies that disprove theory. We can't have ignorance, a refusal to collect data, and the qualitative data being ignored as anecdotal stories.
There are all these people that have gone off to get treated. They say they're doing better. So how could this possibly be working? Because they've already done the experimenting for us. We need to actually learn from them, capture their information.
Noreen had her surgery performed recently at a private hospital abroad and is now back home.
It's been about 2 weeks, and I'm feeling a lot better than when I went in, that's for sure. I mean, I still have some issues that I need to help myself through, and everything isn't 100%, but there's a definite, huge improvement.
And others have obtained real benefits from their surgery.
I haven't choked once and in 18 months, and I used to choke 5 times a day. I was scoped for choking. They did a endovascular, or whatever they call it, put a scope down my throat in 2002. So I'd been choking for almost 10 years. And, I haven't choked once in 18 months. And that was huge because, that is a feeding tube.
We maybe have 25 people that come to our group sort of thing. I would say probably at least half of them have gotten this treatment done. That's a lot. And come back and they're feeling great and I have nothing bad to say about it. And yeah, and so us that are left that, we just can't really afford it. We just kind of go, oh, okay, that's nice. Just, it's wonderful that you can be feeling so great and carry on with your life. And I've noticed too with the ones that have had it done, boy, they come back and they have their faces are flush again. They look good. They look like uplifting. Whereas I know a lot of MS people, you see them and they're very tired, and you can see it in their face and their eyes, and they're exhausted and they're tired.
Even up until a month or two ago, I was still noticing subtle changes in my ability to think and problem solve. And even now, as we're doing harvesting and planting things around our organic garden on our farm, I've got a much better planning capable mind than I've had for more than 10 years. Okay, so that's a wonderful gift to have back. I can think and do numbers in my head again to a great degree. I was always pretty good at that. I've got a son who's a PhD in math. I mean, he got some of that from me, I hope. But to get those pieces back, the muscle spasm has stayed away. The bladder problems have stayed away. The bowel problem has stayed away. I no longer worry about losing bowel control.
I've never, in all my years of taking the medications, because of the daily injections, the Copaxone injections, the painkillers, you know, and everything, there isn't anything that I've taken or done in that 17 years that has left me better than what I am now. So I've got nothing but good things to say.
CCSVI is not MS, and venous angioplasty is not a cure for MS. But for many patients, it offers the possibility of relief from some of their most difficult symptoms. Through research, it's also opening up the possibility of valuable new discoveries about neurological diseases. The National CCSVI Society was formed to try to improve the lives of Canadians affected by CCSVI and to encourage researchers from all disciplines to share their knowledge and discoveries in the hope of one day understanding and curing some of our most devastating diseases. We may not yet fully understand what is happening, but for some patients, something certainly is. We can't afford to ignore it.
We don't know whether this endovascular treatment of CCSVI is the end of the road. I expect it will go far, far beyond this. I think we are pioneers in this first wave of people that went to get this treatment. We're the early pioneers. This will move beyond that. There will be pharmacological solutions. There will be dietary solutions. There will be other lifestyle or medical approaches that we haven't even dreamed of. And that's what we're just hoping to find out. That's what we're here to stimulate, to foster, and hopefully to play a very significant role in.
I do know and I appreciate that the government has very high standards in the medical field. And yes, that's a really great thing, and this is why we are, you know, the way we are. But I do think that if they can relieve some of the exhaustion and fatigue and maybe some of the pain, that maybe some of us can actually get back to work and actually, you know, live a little bit more of a complete life.
Am I glad I went? You betcha. Would I do it again? Yes. Definitely.